Hello everyone, I'm Dr. Brown Bear. Welcome to my YouTube channel. Today I would like to talk to you about nightmares and well-being because the two are really important, and as we'll see, they are associated together. Yes, we'll see. So nightmares are actually disturbing dreams that interrupt your sleep and can wake you up. So if you're sleeping, and then you're having a bad nightmare, then you're just like, oh my god, I'm awake, what's going on, oh, that was just the nightmare. Phew. But they can be really disturbing, and often they reflect your deepest fears and anxieties. So for example, I remember this nightmare that I had, that someone was breaking in my house, my bear house, and this person was stealing all my jars of honey. Do you imagine? No more honey. And I was like, oh no, what I'm gonna do with no more honey? But then I realized it was just a nightmare. But so sometimes people are just like, oh, it was just a nightmare, right? They just dismiss it. But they can really have an impact on their psychological well-being. We'll see how, all right? And so, because they are not just symptom of psychological distress, right? They can really exacerbate and even sometimes cause mental health issues. So according to the DSM-5 TR, which you can see just behind me here, this book is like, here you can see it. This is a very, very big book, actually written by very intelligent people, like myself. And they say that nightmares are associated with severe mental health disorders, right? And the most common of it, post-traumatic stress disorder. Or you can just say PTSD, because I think it's way more cool to say this. And so, with PTSD, so cool, it replaces traumatic experiences that you have had, and this evokes intense fear and anxiety, right? And so this is very common in PTSD to have nightmares. But it's not just PTSD, right? Various mood disorders are associated with a higher frequency of nightmares. For example, a study from Sandman and his colleagues. See, a study from Sandman. This is real, right? This is real study. Sandman. That means the Sandman really exists, and he studied dreams. That's great. And so he surveyed 14,000 Finnish people, and they concluded that symptoms of depression and insomnia were the strongest predictors of frequent nightmares. And other studies found that it was specific to nightmares, not just bad dreams. So the psychological effect of chronic nightmares extend beyond the stress that they cause in sleep, right? Because, for example, they can lead to a fear of going to sleep, which in turn leads to sleep disruption, of course. And this creates like a vicious cycle, right? Where poor sleep contributes to psychological distress, which in turn leads to more nightmares, which leads to more psychological distress, which leads to more nightmares. And so other study from Kobayashi and colleagues, they found that it even has a directive effect, right? So they found that long-lasting trauma-related nightmares actually predicted increases in onset and sleep problems 1 year later. Some other studies also found that nightmares frequency was related to the number of suicide attempts. Imagine, frequency of nightmares was a strong predictor of multiple suicide attempts, even after controlling for depression, anxiety, insomnia, and PTSD, right? So it's crucial to address nightmares. And therapeutic approaches such as imagery rehearsal therapy and cognitive behavioral therapy have shown effectiveness in reducing the frequency and intensity of nightmares, particularly in those with PTSD. So cool. Well, these therapies often involve changing the narrative of the nightmares to reduce its emotional impact. So for example, in my nightmare, of someone stealing all my jars of honey, I could imagine that the person breaking in, it's actually not breaking in, but it's just my friend Gary, right? Who's just coming to see me and who just wanted to share some of his own honey, right? And so we could be having fun and tasting different brands of honey and spread it on toast and having like a honey party. And so alongside therapy, lifestyle changes and self-care practices are vital. So good sleep hygiene, regular exercise, and stress management technique can all contribute to reducing the frequency of nightmares and improving overall mental health. It is also important to create a bedtime routine that encourages relaxation and a safe, comfortable sleep environment. All right, thank you everyone for being here, but it's time for me to go to bed. Don't forget to subscribe to my YouTube channel because next time we're gonna have an episode on depression in bees. So stay tuned, folks, and good night.